Well, welcome everyone to Steps Live. Julia here, Sam's over here in the corner. And today we have Mary Clark, who is going to speak to us a little bit about her practice and specifically acupuncture and some of the other modalities that she uses in her practice. And Sam and I are going to just ask some questions that we've put together, kind of a roundtable discussion. If you guys have any questions, please feel free to comment below and we will have Mary respond to those, through Facebook, or if you want to email us, feel free. All right, so Mary, tell us a little bit about you and your journey and your practice.
Okay. I obviously have an accent, so I'm originally from Australia. I stumbled into this world. I actually started studying accounting, and after 6 months said, oh no, this is not what I want to do. And so I ended up doing an undergraduate in a BA majoring in psychology, and didn't really know whether I should go off and do a master's or what I should do. So I ended up doing a weekend massage course, and I went, wow, this is it. So I started massaging and learning how to massage, and part of the massage course was an internship in China for 3 weeks. So I got to go overseas and do an internship in the hospitals there. And what I loved about it, that was my first introduction to acupuncture, but what I loved about it is that the hospitals integrate their medicine. They have a Western wing, they have a herbal wing, a massage wing, an acupuncture wing, so they do a very comprehensive treatment plan. So that really introduced me to the power of, integrative medicine more than anything, but it also introduced me to acupuncture. And then I went back, finished my diploma in massage, and then went, okay, when am I going to study acupuncture? And I had a mortgage and bills. And so I eventually got my stuff together and started studying. It took me 7 years. I also went back to China and did an internship in the Hospital of Traditional Chinese Medicine in Nanjing, and then I came back, and a few years later moved countries. So, and then had to just do some further schooling. So I've just completed a master's in Oriental medicine, and most recently a doctorate. So, and in November I opened up my own practice in the US. Until prior to that, I was working for other people. So. Does that answer that?
Yes. And so what's your practice called? Just so
Raleigh. Raleigh Health and Wellness Centre.
Awesome. And where are you guys located?
I'm located in North Raleigh, off Strickland Road, just south of 540. On Six Forks Road, south of Strickland Road and south of 540.
Okay.
Yeah.
Awesome. So our next question is, what is methodology behind acupuncture?
Okay, this can get really complicated or not, so I'm going to try and keep it simple. There are approximately 361 basic traditional points, and then on top of that, a lot of therapists, if you have had acupuncture or if you haven't, you may or may not know, but we do scalp acupuncture as well, and that's pretty effective for stroke in particular, and TBI and spinal cord injury. We will do ear acupuncture, and we will also do body acupuncture. So there's anywhere up to approximately 2,000 points, depending on the style, and the school of thought. Many of us now, a lot of people believe that acupuncturists just do acupuncture, but a lot of us actually now have training in orthopedic acupuncture, which is dry needling, and also working on motor points. So if you do go see an acupuncturist, please do know that many of us are actually trained to do dry needling and treat orthopedic complaints from a non-Chinese perspective in particular. So, and you were going to ask about the meridians. Can I intercede there? So I don't like to delve too much into the Chinese moving qi and blood, yin and yang type theory, because it's really difficult for people to grasp unless they have an understanding of Chinese medicine. So, but if people do want to know, basically in Chinese terms, the insertion of fine needles facilitates the movement of, we call it qi and blood, and it will balance yin and yang. And in Western terms, that is the sympathetic and parasympathetic system. But essentially from a non-Chinese perspective, we base the insertion of needles at various points, which are actually located in the subcutaneous tissue and muscle and fascial lines, if you want to get technical. They will actually elicit an effect on the body. So there's research saying that the insertion of a point will stimulate nitric oxide, which will help your blood vessels dilate. It will help stimulate something called adenosine, which will help with pain. It will help release serotonin, GABA, lots of neurotransmitters, opioid peptides, and enkephalins. So all of these hormonal balancing and pain relieving hormones, and it will actually do that at a local effect, and what we will often say segmental. So it will have an effect on the way the actual the spinal cord and brain, which is part of the central nervous system, registers pain. So when we're needling in the body, like the body points, the register of pain will be different, and then there'll be that hormonal release which helps sedate, reduce the pain. I'm talking about pain a lot because pain is one big reason why people do come to see us. Acupuncturists, people will often come to our doorstep when they've tried everything else and nothing has worked. So does that cover things? Not too technical.
So how big are the needles?
Tiny. So I was going to try and demonstrate, but it's really hard to see them on camera. I have really tiny ones, which I will actually leave on a person's body. And so they will be anywhere from 0.1 millimeters. It is just, really, really, really little in terms of size. Then they will obviously get a little bit bigger, but I can throw millimeter type sizes out to you, but my smallest is 0.10 times 0.15 millimeters, and the largest goes up to about 0.25 and 0.75. So we're talking about something that's about this big. If you're needling the glute muscles, they can be pretty deep, but there's no danger to needling as long as you know the body. There's no danger to needling those areas quite deeply. But to give you some perspective, 40 acupuncture needles can fit into one hypodermic needle. So when you're going to the doctor to get your flu shot, just remember that 40 acupuncture needles will fit into that one needle. So they're not huge. And I don't use very thick needles because I don't feel like there's a need for them. But some therapists will use thicker gauges out there. So you will feel a sensation when the needle is being inserted. You may feel a dull, achy sensation along where the area is, but once that needle has been inserted, there should be no sharpness. So most people can relax. I know I'll put 4 or 5 needles in and go and nap and have to set an alarm if I'm treating myself. But yeah, they don't. You will feel them, but they are not supposed to hurt ongoing. And so most people go into a deep state of relaxation, and many therapists call it an acu-nap. So,
yeah. I know. Okay, so what other treatment approaches do you use besides acupuncture?
Okay, so I do massage, predominantly medical rehabilitative massage. I will do cupping, which most people know about after Michael Phelps had it at the Olympics. I will also use gua sha, which is similar to Graston. It's a scraping technique, but the theory behind it is different. E-stim is used readily in clinic. I will use topicals. I use pulse and tongue diagnosis. So if you do come and see me, I might weird you out a little bit by taking your pulse and asking you some odd questions about sleep, digestion, stress levels, and so forth. The pulse can tell us a lot diagnostically, and I will always ask you to stick out your tongue. So don't brush it. I want to see what's going on before you try and clean things up. So, and in addition to that, I will often prescribe herbal medicines and look at supplements, and sometimes prescribe them. Sometimes I'll actually have a look at what you're taking and try and reduce them. I find people take way too many supplements and there's a lot of overlaps. So for me, the intention is minimum dose, maximum effect. So what else do? I do some mindfulness techniques and some moxibustion, which is a Chinese herb that you can use to help facilitate movement of blood and warming of an area.
Awesome.
Very cool. I chuckle a lot when I'm nervous, so don't mind me.
I say a lot, and this one over here is 100%. 100%.
Oh, really?
Really? Okay, so what's the difference between acupuncture and you spoke about dry needling?
Yeah, so the theory bit, like acupuncture works on meridians. It will treat pain, it will treat the musculoskeletal system and all that sort of stuff. But the difference is, training level is different. Our diagnostic level is different in terms of acupuncture, but it will also treat a lot of internal disorders. So aside from the musculoskeletal orthopedic realm, I will, treat gastrointestinal issues. I will help with depression, anxiety, migraines, what else is it that I'm thinking of? Gynecological issues, if I haven't said that, allergies, so I will be able to treat. If you come to me for back pain but you're having trouble sleeping and you've had a sore belly and end up being a bit bloated, I can treat all those three things at once. Dry needling has only actually been around since the 1980s. There's a lot of controversy between acupuncturists and I guess some physical therapists and chiropractors who practice, and the acupuncturists aren't fans of dry needling, but I've seen it done well. Okay, so my only thing is, if you're going to be incorporating dry needling into your practice, make sure you know the body well, make sure you are trained, and then I have no problem about it. Dry needling will often treat chronic and acute pain. They don't touch the internal disorders. The needles can tend to be a bit thicker, and often enough they will try and elicit a twitch response. So discomfort post-treatment can last for about 24 to 48 hours when it comes down to dry needling if it's heavy stimulation. But again, you can get that with acupuncture if you're doing orthopedic points or motor points. So, but yeah, so the big difference is one treats internal and external disorders, and the other one really relies on external conditions such as pain. Yeah.
Awesome. What are the most common neurologic diagnoses that you see?
Back pain, headache, migraine, dizziness and vertigo, stroke, TBI, particularly concussion from sports. I'm seeing a lot more of that lately. And the other one is post-chemo neuropathy. So, but back pain is the one that wins everything, in terms of, the most common treatment that people seek through acupuncture.
Why do you feel most people with TBI or stroke find their way to you?
A number of reasons, I guess. A lot of them are frustrated with their progress. And then there are many who actually have a friend who may have gone to see an acupuncturist and had some results. So they're intrigued. And, the more research a patient does, the more they realize that it's, I am going to work on pain relief, better range of motion. Because I also do body work, I will often combine acupuncture with massage therapy to try and improve range. There, you know, improvements in spasticity and tone, things like reduction in tremors. You know, we work on helping with motor control. So outside of that component, you know, there's a whole host of symptoms that a person who's had a TBI or a stroke will experience, you know, gastrointestinal distress, so the psycho-emotional. So this has rocked their world. They no longer feel safe in their own body. So I work on really calming the nervous system, and acupuncture is great for that because it takes you out of that, what they call sympathetic fight or flight, a bear is chasing me, into this state of calm. And this can the state of calm can carry on for a few days after treatment. So that's the other big part. And also cognition. It helps really cognition and fosters brain plasticity, so, you know, through the neurotrophic factors. So but usually people will sort of say, oh, look, I'm done, I want to try something else. Or I've heard from a friend of a friend, or I've read on the internet that acupuncture can be helpful. So, and my role is very much in working towards education, you know, basically working along with OTs and PTs like yourselves and really trying to work together to get the most optimum benefit for the patient. And if I can make a change in tone or range of movement and allows you to do more during your sessions, then that's a win for me.
Yeah, I would say that that's probably the collaborative piece of it. Like, I acknowledge when I have a patient who's seen you the day before, there is 100% a difference in their affected upper extremity or lower extremity, like with movement. And they're just so much more relaxed and willing to work on different things at that point because their brain is so much more accepting of it.
Yeah. Yeah.
Yeah, I think.
And yeah, that's a big thing. It's about, you know, also not getting in their own way, and also being relaxed and allowing the body to move without, you know, some of the patients that I treat that see you, you know, they'll get in trouble if they're not wearing an AFO, and I encourage, you know, wearing you know, whatever devices you recommend, because it actually makes a difference on the rest of the body. So I know if you haven't been wearing the AFO, I know that your tone is going to be pretty crappy in the arm, you know. So so you get into a little bit of trouble here sometimes, and I'll look at you sternly. I don't have children, so I'm practicing my motherly skills, but it does make a huge difference. And so it's good to hear that, you know, the treatment will carry on, and the work can be more impactful after they've had, you know, some other work done, you know. And it doesn't need to necessarily be me through acupuncture and massage, but anything that helps, you know, calm the nervous system down and relax the muscles is beneficial.
For sure. Let's see. So what are the largest benefits, and you've already spoke a little bit about this, but in your clients that you have seen from intervention? So reduction of spasticity and...
Yeah, reduction of pain is the big one. With nerve type pain, you know, we can talk about numbness, tingling, odd sensations, burning, etc. A lot of my patients they'll come in and they're a 10 out of 10. I can't take this anymore. My next line of action is to take, you know, an opioid. And many of those patients will go down to a 0. Some of them will never get down to a 0, but we can reduce that to 4 or 5, and it actually just allows them to get some quality of life back. So, you know, the big thing is through the reduction of pain or other symptoms, and this also applies to the emotional component, we can avoid antidepressants, anxiety medications, pain medications, even blood pressure medications. If we're really, that's where people get in trouble as well, because I talk about lifestyle a lot. It's, again, I can only do so much in this room, and you need to help yourself. So, sleep, you need to sleep really well, or work on sleeping well. You need to hydrate, have a good diet, get some sunshine, etc., etc. So I work on what I call the pillars of health in addition to what I do in clinic, because I want you to walk away and feel empowered and give yourself the opportunity to be able to care for yourself and even extend the benefit of treatment. So I hope that answers the question. I ramble, don't I?
So what are the pillars of health?
Well, for me, it's really about exercise, it's about sleep, it's about nutrition, it's about hydration. I also put in community and spiritual health, because they're really important. So, it depends. But generally it's about, what are the ways you can care for yourself in the everyday. We all need a little bit of exercise. So, I know many of your patients won't be able to run a marathon, but they can walk around the block. And so that is a win. So, even walking to the letterbox and back, post box, sorry, I'm using the Australian word, am I? Even walking to the post box and back, or down to the edge of the driveway, or to the street, like that is, it is getting outside, and it's a bit of exercise, and it actually, helps you physically and with your mood. So, so I'll talk about those in particular. Depending on where you read, some people say there are 4 pillars, others say there are 9, but I've got the couple key ones where I sort of say, look, sleep, diet, exercise, stress reduction, and so forth. So
awesome. What are the most common concerns for acupuncture expressed by your patients?
Does it hurt? That's the big one. That, and again, it isn't, we don't like to call them needles. Some people call them filiforms, but look, I call them pins, which is probably bad. But look, they are needles, so it is going to feel like a prick, but it's definitely not going to feel like a hypodermic needle. And the thing is, your therapist should be able to accommodate their needling style to your needs, right? So I've had some 14 to 17-year-olds come in and totally terrified. So I'll start with my baby facial needles, and we'll start there. And now they're on to, the slightly larger needles, and I can stimulate them a little bit more. So, I will work with you. I've done part of my postgraduate studies was a year in Japanese acupuncture, and you barely even insert the needle. Sometimes you even just tape it on. So there are so many techniques at our disposal to make you feel comfortable. And then other people read about, nerve damage and so forth. We have thousands of hours of training, so we do know where the nerves are. We do know that the lungs actually go all the way up here. So our technique will be different when we're needling up anywhere near the lungs or anywhere near the organs. We will choose a different length of needle. So, we do all take precautions, because for me, patient safety, do no harm that's my number one thing in clinic. So I will never do anything to compromise. I won't even push boundaries in terms of my placement of needles. So, so they're the kind of big concerns, will I walk away, sometimes people also ask, will I walk away feeling worse? 95% of cases, no, but there's a couple where you actually have a healing crisis and you don't feel great. And so I always warn my patients about that and say, look, I'm available, reach out if you feel any worse, but it will pass. It is the body trying to regulate itself. So I think that's it. Would you have any concerns about acupuncture?
This is like, everyone always asks, well, does it hurt, or how big is the needle? I'm like, it's not that big, and I don't. If it hurt, people wouldn't do it.
Yeah.
That's like my theory on it.
You've covered it. So
it's more of like an odd feeling
sensation
than actual pain.
Yeah.
What are the most common symptoms that acupuncture address for those with traumatic brain injury, stroke, spinal cord?
Okay. Sensory difficulties, headache is particularly TBI, headache, chronic and recurrent is number one out there. Insomnia, function, range of movement, generalized pain, that's up there. I do some PTSD type symptoms in terms of where it really depends. Like if I think about TBI or spinal cord injury and I'm thinking military, sometimes there is some PTSD post-injury, and it also can happen from car crash. The people are reliving the trauma. So acupuncture, particularly ear acupuncture, can help with that. And sometimes I'll see a bit of substance abuse if it's not, a way to manage and cope. So I will work on treating that. And yeah, sleeping difficulties, gastrointestinal stuff. So, but the big ones are really headache, insomnia, and range of movement, muscle tone.
Do you have any experience working with clients who have neuropathic pain or abnormal sensations? And
yes,
what have your outcomes been? I mean, like we have a lot of clients that end up having neuropathy.
Or even abnormal sensations that the typical desensitization methods that we learn about and that we tend to kind of use as the first line of defense.
Doesn't work.
It either works to like a certain point, or it's just hard to get over that hump, or it happens and then it kind of starts to creep back. So
again, it depends, so I will treat a lot of chemo-induced neuropathy, and the results can be really good if we get that early. If the neuropathy is from being a type 2 diabetic or poor controlled glucose metabolism, then I really go back to the diet and we try and reverse that. And in my experience, acupuncture isn't as effective in that realm unless there are changes at the base level. But in terms of other neuropathies, it depends on the severity, it depends on the overall health and condition of the patient, how many other comorbidities they do have with them. But we can often reduce that pain, reduce that odd sensation. So again, sometimes down to zero, and then sometimes just at a level that is manageable. The patient can feel it, but they're not distressed by it. I mean, I've had patients come back after neuropathic pain and say, look, that area still feels a little bit odd, but look, it was a 8 or 9 when I walked in here. Now after a couple of sessions, it's around a 2 or 3, and let's work on something else.
Awesome. Yeah. So this is one of my favorite questions. Do you have a quote that you live by?
My favorite quote at the moment is take a rest. A field that is rested gives a bountiful crop. And the reason, I guess the pandemic has forced many of us to rest, but what I have seen clinically for the last 22 years of practice is people are busy, too busy. They are running themselves ragged, and then they wake up one day and wonder, where did all this pain, discomfort, where did these disorders come from? Why do I have a thyroid issue? Why do I have this going on? We don't stop to regroup. We don't sleep enough. So I harp on about this a fair bit on social media. I really want, and I am doing this more and more myself. I after finishing the doctorate, I was, up until that stage, I was busy and I moved countries and all that sort of stuff. But now I've really kind of worked out what's important, what do I really need to focus on and do, and where am I not nourishing and nurturing myself? And that's not necessarily just through food or self-care. It's about spending time with family, limited these days, friends, being outdoors, spending time hanging out with pets, etc. So, I really want people to maybe scale down, minimize that craziness that depletes everyone, and work out what really matters. So, and I'm working on that one. It's a work.
Oh no, you're frozen.
That was probably, Mary, you're talking too long. We need to put you on pause for 5 minutes. But yeah, so all I was basically saying is I really, for myself and the rest of humanity, I want us to be gentler on ourselves and not so demanding, and to really just, life's too short. So, work out, do things that actually, make you happy and make you feel fulfilled and complete, and, all that important stuff. So
I love it. That's a great quote.
Yeah.
All right. Is there anything that you want our clients to know? Any additional tidbits?
The only thing that I really want clients to know is that, acupuncture needn't be that scary. If you do come and see me and you're fearful, sometimes it's a matter of just getting a massage, and I'll put one needle in so you can get a feel for what it, what it is like. So some people go, oh no, that's enough. I won't do any more, but it does open the avenue. And also, the acupuncture's not there just for pain. We can treat so much more. So, I can treat a couple of things at the same time during your session. And the big thing is, my goal is to help you reconnect with your body and feel comfortable in your own skin again. And after, a TBI, spinal cord injury, and, a stroke, we can be out of sorts for a long time, and struggle emotionally, as well as obviously the physical component. So that's, I really want to create a space where, you're at peace, because sometimes every day is a struggle. Yeah, well, that's all.
Well said. All right. Well, okay. So what's your phone number? How do people get in contact with you? Do you do online?
Yeah, I do. So my website is www.raleighwc.com. My cell number's on there, so 919-909-5736. There are bookings online, so you just pop on over to my website, and there's a book now button, so you can pop yourself into my calendar whenever it works for you. If not, you can call. There's an email address there, and I can also book you in if you're having any issues doing so online. And yeah, and I guess COVID's going to come up. I'm wearing a mask the whole time. I have made my actual safety and cleaning procedures are actually on my website. So if you have any concerns, you can definitely read through those. I'm taking absolutely every precaution I can, but I know also that some people are in the high risk category and don't feel that it's safe just yet. And that's okay.
Yes.
Yeah.
All right. Well, thank you everyone for joining us today, Steps Live. We'll be posting our schedule for next week. Next week's our last Steps Live week, and Katie will be doing a presentation, and so we'll have more information on that.
Wonderful. Thank you, everyone.